Good evening, everybody. Wonderful to see so many people. Hope you and your families are safe and well as always. Welcome to the presentation on changes in retiree health insurance benefits. We appreciate everybody being here tonight. We have Kim Parker and her team who will be giving the presentation. The run of show for tonight is that we're going to hear in a minute from our president, Dr. Proscia. And then we're going to turn it over to Kim to introduce her team and go ahead and do a presentation, a PowerPoint presentation. And by the way, tonight's meeting is being recorded. Once the presentation is through, then we really appreciate everybody sending in the questions in advance. We've shared them with Kim. We're going to ask them if they've been answered already. We'll move on to the next question. We have a number of questions to go through because we indeed did get a fair number of questions from folks, which is good. Then time permitting, we'll go to the questions that are being submitted in chat. And then if there's time enough after that, then we can try to open it up. But if not, we'll try to get through as much as we can. With that being said, let me bounce it over to our president, Dr. Proscia.
Right. Thank you very much, Kevin. Good to see everyone here tonight, both our current retirees and many of our actives. Hope you and your families are well and wishing you all a better 2022. Thank you for attending this informational presentation and for the many questions, as Kevin said, that were already provided. Lastly, though, I want to emphasize any changes that are discussed here tonight regarding the Medicare Advantage Plus will have no impact on our own Doctors Council benefits through the Doctors Council Retiree Welfare Fund. Just wanted to mention that. Okay, back to you, Kevin. Thank you.
Thank you, Dr. Proscia. Appreciate those comments. And folks, let's get to it. I'm pleased to introduce, and we're appreciative of her and her team's time, Miss Kim Parker. Kim, I will bounce it over to you, and if you'd be kind enough to introduce yourself and your team.
Sure. First and foremost, I want to thank the Doctors Council, Dr. Proscia, Kevin, for setting this up and organizing this. We're happy that we have an opportunity to provide some education and have an opportunity to answer some of the questions from your retirees and pretty much clear up some misconceptions that are out there. I have a couple of colleagues with me here today, this evening. Marlon Pavone is the other account executive that is managing the City of New York retiree plan with me, and we're both from Empire Blue Cross Blue Shield. I also have Ann Feminello and Chris Gugea that are both here from Empire Blue Cross Blue Shield, and Kathy Smith McInerney, who's from Emblem Health, who can address Part D pharmacy prescription questions tonight.
Kim, would you
now,
like
Kevin, are you going to be sharing the presentation?
Yes.
Okay,
Absolutely.
great.
We'll do it right now. Here we go. Just bear with us for 1 second till we set this up. Okay, Kim.
Okay, wonderful. You could actually roll right to the next screen. Keep on going. I'll go right into the agenda for tonight's meeting. Once again, I'm Kim Parker and I'm from Empire Blue Cross Blue Shield. I am the account executive that's responsible for managing the New York City Medicare Advantage Plus plan on behalf of the City of New York and the City of New York retirees. Tonight's presentation, I'm going to go through a couple of items. First and foremost, I'll go through a few of the new updates, specifically to the push off of the scheduled effective date and some updates in regards to opt-out dates, switch periods. So I'll be going through all of the new updates. We'll do a review of Medicare basics and how Medicare Advantage compares to traditional Medicare. We'll spend some time talking about the National Provider Access. We'll review through the benefits and features of the program, specifically a comparison of how the New York City Medicare Advantage Plus plan compares to the GHI Senior Care Plan today. We'll also review through some of the enhancements that are included in the program. And then finally, I'll be spending quite a bit of time talking about the enrollment process, specifically the opt-out process and how the logistics of rolling out the Medicare Advantage Plus plan will impact the City of New York retirees. And then obviously at the end, we'll review through those pre-submitted questions that were sent in to Kevin Collins over at the Doctors Council. So Kevin, you can move right on to the next slide. On this slide, this goes through some notable changes that I want to review. Now, as many of you know, you've received the postcard from the City of New York announcing that the planned rollout of the Medicare Advantage Plus plan that was originally scheduled for January 1st has been pushed off. So the new scheduled effective date is planned for April 1st, 2022. So that is the new scheduled effective date that the plan is looking to be launched. There is a new opt-out deadline, and it's been extended to March 31st of 2022. So members will have an opportunity to opt out, to keep their current plan if they choose to, and not enroll into the New York City Medicare Advantage Plus plan. And you'll have until March 31st to submit your opt-out decision. For those retirees that have already opted out and submitted their opt-out form during the fall period, you do not need to submit a new opt-out. So your original opt-out that you submitted in the fall will be honored. So there's no need to submit a new opt-out. However, there are some retirees that have changed their mind and want to go into the Medicare Advantage Plus program, and you can rescind or reverse your opt-out that you submitted in the fall. And you can do that by simply calling the Medicare Advantage Welcome Call Center, and that number is 833-325-1190. And I will have it on the screen, and we'll be repeating it again later in the presentation. But you can call that number, let them know that you're rescinding your opt-out, and then you can be enrolled in the Medicare Advantage Plus plan. Now, in addition to the extended effective date and extended opt-out period, the City of New York is offering an extended opportunity during a switch period that's going to run from April 1st through June 30th, 2022, that will allow retirees to make another plan change between the New York City Medicare Advantage Plus plan and your current plan, or vice versa. So you will have another opportunity to switch back and forth during that extended switch period. All retirees will only be responsible for one health plan deductible for the 2022 calendar year. And what that means is, if you're currently on Medicare and the GHI Senior Care Plan between January and April 1st, if you meet your Medicare Part B deductible and plan deductible, you will not have to meet the new deductible under the Medicare Advantage Plus plan when it's rolled out in April. So members will only be responsible for one health plan deductible for the calendar year of 2022. Most retirees have probably received, well, I should say all retirees should have received the 7-page letter that was mailed out by the Office of Labor Relations, Renee Campion. And the letter is basically outlining everything that we just touched upon here. It talks about the new scheduled effective date. It talks about the opt-out period. It talks about the extended switch period. It also goes into great detail to try to incorporate many of the frequently asked questions subjects into that letter. So it talks about the enhanced benefits. It talks quite a bit about the provider network and the access to providers. So it's a 7-page letter that condenses everything that you've received to date, that you received in the fall, all in one comprehensive letter. And those letters were mailed out in the beginning of January. Kevin, you can move to the next slide. You can keep on going. Now on this slide, this gives you a high-level overview, a comparison between how original Medicare compares to the Medicare Advantage Plus program. So currently today, members have original Medicare or traditional Medicare, which is divided into two parts. Medicare Part A, which is your hospital benefit of Medicare, And then there's Medicare Part B, which is your medical or doctor's portion of Medicare. And then most retirees have the GHI Senior Care Plan, which is the secondary or supplemental plan. Under the New York City Medicare Advantage Plus plan, we're combining all of those pieces together into one program. So the Medicare Advantage Plus plan becomes the administrator of your Medicare benefits. Since we're contracted with the federal government, we have to cover everything that's covered under traditional Medicare today. So if it is a Medicare covered service, it will be covered under the New York City Medicare Advantage Plus plan. So we will cover all of your Medicare Part A benefits, all of your Medicare Part B benefits, as well as fill in many of the gaps in Medicare. Now, in addition to all of the required Medicare benefits that we must cover, the plan also includes a whole host of enhancements that neither Medicare or the GHI Senior Care Plan cover today. And I'll go into a lot more detail specifically about these enhancements, but just to call a few of them out, you have Silver Sneakers, which is the free gym membership program. There's a non-emergency transportation benefit, a wellness benefit, healthy meals, just to call a few of them out. Now, I want to let all retirees know that this program was specifically created for the city of New York. So the benefits are specific to the city of New York retirees only. So people off the street cannot purchase this program. This is a custom group plan that was created for the city of New York and the city of New York retirees. It is a national program. So this program will cover retirees in any of the 50 states that you live or the US territories. So it is a national PPO program that covers you wherever you live within the United States or US territories. As I said, it's a custom plan created specifically for the city of New York. So it's not one of those individual Medicare Advantage plans that you see advertised on TV. It is not a Medicare HMO program. This is a passive PPO program that affords you the ability to go in or out of network. So it allows you the freedom to see any Medicare participating provider. And Kevin, this actually brings me to the next section, which is the national provider access. Now, this is probably one of the most important questions that we've received from retirees over the past few months is what providers will I be able to see under the Medicare Advantage Plus program? The program, as I said, is a national PPO. It's a passive PPO. And what that means is whether you see an in-network contracted provider or an out-of-network provider, the cost share for those services as the member is the same. So you have the freedom to see in or out-of-network providers, and the claim is going to be covered the same for you as the member. Now, we do have a national PPO network, which is comprised of the whole national Blue Cross Blue Shield Medicare PPO network. So the in-network contracted providers participate in either Emblem Health, Empire Blue Cross Blue Shield, or any one of the various Blue Cross Blue Shield programs that are located throughout the country. So for example, if you live in Florida, your in-network contracted providers participate with Blue Cross Blue Shield of Florida's Medicare PPO plan. If you live in New Jersey, it's Horizon Blue Cross Blue Shield's Medicare PPO program. North Carolina, it would be Blue Cross Blue Shield of North Carolina's Medicare PPO program. So from an in-network contracted standpoint, you have access to all of the Blue Cross Blue Shield Medicare PPO providers nationally, as well as the Emblem Health Medicare PPO providers. But I do want to emphasize the fact that you are not bound to only see in-network contracted providers. You have the freedom to see an in-network or out-of-network provider. Now, one of the questions have come up, how do you pay an out-of-network provider? If you see a provider that does not participate in our network through Blue Cross Blue Shield, they're a Medicare recognized provider. You can see that provider on an out-of-network basis. That provider will bill the plan directly, and we will pay the provider the same Medicare allowable amount that they're receiving today under traditional Medicare. So out-of-network providers will receive the same payment that they've received through traditional Medicare today. So you have the freedom to go in or out of network. I do want to emphasize specifically in New York, there's been a lot of questions around the hospitals that participate or contracted in the network. And I can tell you that every single hospital in the state of New York is an in-network participating hospital. This includes Memorial Sloan Kettering, it includes Hospital for Special Surgery, it includes New York Presbyterian, Columbia, it includes every New York hospital is in network with Empire Blue Cross Blue Shield and is a participating hospital in the network. So once again, you have the freedom to go in or out of network. You have access to well over 640,000 individual providers that participate in the network nationally, but you also have the freedom to see an out-of-network provider. Kevin, you can move on to the next slide. Now, I said you're not bound to only see in-network contracted providers, but many members want to know that their providers are in the network. Two easy ways to confirm this. Simplest way is to call the New York City Medicare Advantage call center, and that's the 833-325-1190 number, and have a representative look up your providers on your behalf. Or if you want to search through the provider search tool, you can access that through the dedicated website we set up under empireblue.com/NYC-MA-plus. And in the middle of the page is the Find Care link. You can click on that and you can look up providers based on their name, specialty type. So you'll just need to know either the zip code or the city and state where the provider is located. Type in their full first and last name, and you can look up specific doctors. Or you can do a broad provider search. So if you want to see all of the cardiologists that participate in your zip code, you can type in your zip code and put in the provider specialty type cardiology, and it'll pull up all of the cardiologists that are in the plan. You can look up hospitals. So you have the ability to either look up specific doctors by name, or you can do a broad provider search. Kevin, you can move on to the next slide. Another question that has come up quite often is in regards to referrals or the prior authorization process. There are no referrals that are required under the New York City Medicare Advantage Plus plan. So you do not need to get a referral from your primary care physician in order to see a specialist. So you can schedule your specialist appointments on your own. You do not need a referral. However, there could be some services that may require prior authorization. And the prior authorization process is basically the medical necessity review process. Now, the plan follows the same Medicare coverage guidelines and the same Medicare medical necessity guidelines that are in place with traditional Medicare today. But what's different is under traditional Medicare, the medical necessity review process happens retrospectively on the back end after a service has been rendered. And if Medicare reviews a claim and determines that medical necessity requirements were not met, they could deny and reverse that claim, which means the member would be ultimately responsible for paying that full bill. Under the Medicare Advantage Plus program, through the prior authorization process, that medical necessity review process is done on the front end before the service is rendered. So that prior authorization process really creates no surprises for the member or the doctors. They know that the service is going to be covered. Now, not every service requires a prior authorization. There is only a subset of services that require pre-certification or prior authorization. Some of those services would be your planned inpatient hospital admissions and surgeries, your complex diagnostic testing like CAT scans, PET scans, MRIs, your therapies like your infusion therapy, radiation therapy, physical and occupational therapy, admission into a rehab or a skilled nursing facility. So those are some of the services that may require the prior authorization. And excuse me, the prior authorization is handled by the doctors. So the in-network contracted providers are required to process the prior authorization paperwork directly with the plan. So the providers are the ones that coordinate the prior authorization. It's not the member's responsibility. Out-of-network providers are not required to seek prior authorization before the service is rendered. We encourage them to, because that ensures that there's no surprises. For out-of-network providers, the claim would be retrospectively reviewed the same way as it is under traditional Medicare. Once again, we follow the same Medicare coverage guidelines, and we follow the same Medicare medical necessity guidelines that traditional Medicare follows, except the process is different. It happens on the front end under the Medicare Advantage Plus plan, and under traditional Medicare, it's retrospectively reviewed on the back end. Kevin, you can move on to the next slide. Now, the next section is really just a high-level comparison between the New York City Medicare Advantage Plus plan and the GHI Senior Care Plan. And the reason why I'm doing a comparison between those two programs is because the majority of the City of New York retirees are currently covered under the GHI Senior Care Plan. But for those retirees that may be covered under another plan, may it be Aetna or HIP VIP or Empire Medicare Related or United or Humana, the Office of Labor Relations website does have plan comparisons for every single program that's offered through the City of New York on the Office of Labor Relations website. So you can go on to the OLR website and you can see a side-by-side comparison between your current plan and the New York City Medicare Advantage Plus plan. Kevin, you can move right on to the next slide. So this is the high-level benefit comparison. And you'll see for 2022, the GHI Senior Care Plan has a combined deductible of $283. And what that is your Medicare Part B deductible for 2022 has gone up from $203 to $233. So you have to first satisfy that Medicare Part B deductible of $233, and then you have the $50 plan deductible under senior care. Under the New York City Medicare Advantage Plus plan, you have the one single deductible of $253. But what's very important to note here is members will only be responsible for the one deductible. So if you meet your deductible between January and April 1st, under the senior care plan, you will not have to then satisfy a new deductible under the New York City Medicare Advantage Plus plan. So if you've satisfied your deductible in the beginning of the year, before you roll in to the Medicare Advantage Plus plan, that deductible will be satisfied. Now, the New York City Medicare Advantage Plus plan does have an annual maximum out of pocket, and that's $1,470. So that's the most a member would pay in co-payments throughout the course of the year. So that is your catastrophic cap. Once you reach that in out-of-pocket expenses under the medical plan, you will not be responsible to pay any more additional co-payments. So that is your cap. Under the senior care plan, there is no catastrophic cap. And what that means is your co-payments and your cost shares will just continue. So you do not have a catastrophic cap that has a threshold that will stop the co-payments from being charged. So that's the difference between the two plans. Both programs have a $300 co-payment for inpatient hospital admissions. So it's $300 per admission with the $750 per person maximum per calendar year. So that would be the most that you would pay in hospital copays for the year. Skilled nursing facility care is covered at a zero copayment for the full Medicare benefit period, which is the 100 days. So from days 1 through 100, it's covered in full, zero copayment for skilled nursing facility. Now, the difference for the primary care physician visit is under the GHI senior care plan, there is now a $15 copayment that you will be responsible for when you have your primary care physician visit. And your primary care physician is your internist, general practitioner, or family practitioner. Under the New York City Medicare Advantage Plus plan, your primary care doctor copayment is $0. So there is a difference between the two plans there. Specialist visits under both plans is a $15 copayment. Now, I do want to call out that this is a new change for the GHI senior care plan effective January 1st of 2022. So this is new. For those of you that have been on the senior care plan, you did not have to pay copayments in the past. Starting January 1st, you will be responsible for a $15 copayment for all of your office visits, and that includes primary doctor and specialty care. Emergency room is covered. There's a $50 copayment for the emergency room visit. Under the Medicare Advantage Plus plan, if you're admitted into the hospital within 72 hours of that emergency room visit, you will not be subject to that $50 copayment, so it will be waived. Dialysis is also covered at a $0 copayment under both plans, whether it's on an outpatient dialysis or dialysis that is done in the in-home setting. Kevin, you can move on right to the next slide. Just want to go through a few high-level benefits. Diagnostic testing like CAT scans, X-rays, complex radiology lab work. Both plans have a $15 copayment for those services. The $15 copayment specifically for lab work, a question came in, is it $15 for every separate lab test? It's a $15 copayment for the full lab order. So if you have a whole host of lab work that's being done on the one lab order, that's the one single $15 copayment. Mental health and substance abuse outpatient services are covered at the $15 copayment because they're a specialty visit. Urgent care is a $15 copayment. Durable medical equipment, this is a little difference between the two plans. Under the New York City Medicare Advantage Plus plan, durable medical equipment is covered for a $0 copayment. Under the GHI senior care plan, there is a separate $25 plan deductible that applies to ambulance, durable medical equipment, and private duty nursing. So there's an additional deductible that needs to be met. And then there's also an annual maximum benefit of $2,500 for those three benefits combined. So the most this GHI senior care plan will pay towards those three benefits would be the $2,500 for the year. And then there's also additional benefits that come with the program, the meal benefit, transportation, hearing aids, and wellness. Now, hearing aids, I just want to call out that there is a $500 allowance, and that's every 12 months towards the purchase of a hearing aid. And you can stack this on top of the benefit that you receive through your union welfare fund. So you currently have a hearing aid benefit through the union welfare fund. This you can use first. So you'll be able to apply that $500 allowance to the purchase of a hearing aid first, and then submit the balance into the union welfare fund to get the benefit that you have through the union. So they are benefits that it's not either or, they can be stacked on top of each other. Kevin, you can move right on to the next slide. And you can go right on in. So the prescription drug option, for those retirees that do not receive their prescription drug coverage through their union or welfare fund, you have the opportunity to purchase the City of New York Enhanced Prescription Drug Plan, and that is administered through Emblem Health. So Emblem Health is the current provider that offers the City of New York Enhanced Prescription Drug Plan, so that's not changing. It will still be administered through Emblem Health. The plan design is the same, so there's no change to the benefit structure of the current plan rider that's in place today. It is still a Premier Access open formulary. You can still receive your prescriptions 90 days at a time, either through retail or mail order. There is a broad pharmacy network for you to choose from a retail standpoint. And the good news is the premium for the enhanced prescription drug rider is going down effective January 1st, 2022. So it's going down to $125 per member per month. So this is the prescription drug plan that will go along with the New York City Medicare Advantage Plus program or the GHI Senior Care Plan. Now, what's important to note is if you're a retiree that has gone out and purchased an individual Part D plan on your own, that individual Part D plan will be impacted by the New York City Medicare Advantage Plus plan. The federal government does not allow members to be simultaneously enrolled at the same time in both a group Medicare Advantage plan and an individual Part D plan at the same time. So the enrollment into the group Medicare Advantage Plus plan will terminate you out of your individual Part D plan. So you will need to pick up the New York City Enhanced Prescription Drug Plan for the April 1st start date when the Medicare Advantage Plus plan goes into effect. We can move right on to the next slide. You can keep on going. I just want to give everyone an opportunity to jot this number down. This is the Welcome Call Center number that I mentioned earlier, and it's 833-325-1190. And the call center staff is open Monday through Friday, 8 a.m. to 9 p.m. Monday through Friday, and that's Eastern Standard Time. The representatives are trained on the New York City Medicare Advantage Plus plan. They're also trained on all the other programs that the City of New York offers. So they're there to really answer any benefit question or any question related to the rollout of this program. They're there to address all of your concerns. They're also there to help look up providers on your behalf. So if there's anything that's not addressed during tonight's presentation, or if you think of something after the meeting tonight, I do encourage you to give the call center a ring and have the representatives help answer any open questions that you have. So once again, they're open Monday through Friday, 8 a.m. to 9 p.m. So they're there to answer all the questions that you have. Kevin, you can move on to the next slide. You can go right to the next one. This is the enhancements that I spoke of early on, and these are the benefits that are currently not covered through traditional Medicare or the GHI Senior Care Plan. So these are additional enhancements and benefits that come with the New York City Medicare Advantage Plus plan. The first one is Silver Sneakers, and that's your free gym membership. Members will have access to over 16,000 Silver Sneakers gyms that participate in the program nationally. It is a portable program, which means you can utilize a Silver Sneakers gym in whichever state you're visiting or you're in. So if you're a snowbird, you can use a Silver Sneakers gym in New York and then go to Florida and change your Silver Sneakers gym to a Florida location. So it goes with you wherever you travel across the country. But they've also recognized the fact that not everyone is comfortable going back to an in-person gym setting. So they've adapted as a result of the pandemic to create virtual and on-demand classes, as well as flex classes and programs that you can do in your own home. So they're really creating programs that are going to address the needs of all retirees. We also have the Concierge Health Guide, which is the customer service model that was developed to support the City of New York retirees that are enrolled in the Medicare Advantage Plus program. This is a customer service team that goes above and beyond a standard customer service team. So these representatives are there not only to quote benefits and look up claims, but they're really an advocacy program for our members. They're really there to help members navigate the complex healthcare system. So they'll get on the phone and help schedule doctor's appointments on your behalf. They'll also help you access all of the benefits and programs that are included in the Medicare Advantage Plus plan. So they're really there to act as an advocate on your behalf. The non-emergency transportation benefit is basically a car service to and from your doctor's appointments, pharmacy, or hospital visits. So the non-emergency transportation benefit, it's 24 one-way trips to and from your provider appointments. You'll want to set up the non-emergency transportation ride at least 48 hours before your doctor's appointment. And this is where the concierge health guide can come in to help. They'll be more than happy to help coordinate setting up that car ride for you under the transportation benefit. We also include telemedicine or telehealth through our Live Health Online application. You'll have the ability to have a virtual doctor visit directly through your smartphone, your tablet, or your computer, directly with a board certified physician. And those telehealth medicine visits through Live Health Online are covered for zero copayment. And that is for medical visits or also behavioral health. So there is a mental health component of Live Health Online as well. The healthy meal benefit is primarily designed for post-discharge from the hospital. Members will be eligible for up to 56 meals delivered to their home each year post-discharge from the hospital, or a member could qualify for the healthy meal benefit if they are a diabetic and their A1C levels are elevated, or if they have a certain body mass index number. And we also have the healthy pantry benefit, which is designed for members with certain chronic conditions to help manage those chronic conditions better through a few minor dietary changes. So members that qualify for the healthy pantry benefit could be a cardiac patient, could be a diabetic member. Those members will receive a shelf-stable pantry box delivered to their home each month, as well as having a monthly nutritional counseling session with a dietitian telephonically to make sure you're staying on track. We also want to incentivize and reward our members for doing their wellness and preventive screenings. So through the Wellness Rewards program, members have the ability to earn gift cards for doing their wellness and preventive screenings. So when you do your health risk assessment in the beginning of the year, when you do your annual physical, you go for your colonoscopy or your mammography, you have the ability to earn gift card rewards through this Wellness Rewards program. We also have the Sydney mobile app, which is the mobile app that you can download to your smartphone that allows you to download your full benefit program right in the palm of your hand. So you'll be able to access your benefits, view claims, view all of the enhancements and the benefits and services that are included in the plan, as well as download your identification card right to the Sydney mobile app. We also have the 24/7 nurse line that is there to support our members. 24 hours a day, 7 days a week. This line is staffed by registered nurses. And the purpose is really to help triage care for members. So they're there to answer medical questions and really help assess your symptoms so that you're getting the appropriate site of care at the appropriate time. Quite often, this is utilized in the middle of the night when you're exhibiting something and you cannot get in touch with your family doctor, but you need to speak to a medical professional. You can call the nurse line, they'll go through the symptoms. They may tell you that it's something that you really should probably get to the emergency room for right then and there, or they may tell you it's something that you could probably wait until the morning until you can get in touch with your family physician. So they're really there to help triage and assess symptoms. They're not in place of the doctor, but they're really there to help direct you for to get you the appropriate care that you need. We also have worldwide coverage for emergency and urgent care. And this is important because traditional Medicare does not cover you outside of the United States. So under the New York City Medicare Advantage Plus plan, you will be covered for emergency care and urgent care while you're traveling anywhere in the world. We also have special offers, which allows our members to receive specific products and services through preferred vendors at a discounted rate. So for example, you could get discounts on vitamins, discounts on diet programs like Jenny Craig. So preferred vendors will offer our members discounts on their products and services through the special offers program. We also have the Medicare Community Resource Support, and this is a team that helps connect members with the local community support that's available in your own neighborhood. Many of us do not even realize the amount of community support that's available to us because we don't know where to look for it. This community resource team is going to help connect that member to that local community support in your neighborhood. A good example would be connecting a member with a local church to have them come in and help build a wheelchair ramp on their home. So that's how we connect the member to the local support. We also have the health and fitness tracker, which is basically a free Fitbit that members will receive every 24 months, as well as the ability to link into the online programs that link up to your Fitbit that help you track your track your activity. Routine foot care, which is typically only covered if you're a diabetic under traditional Medicare, is now going to be covered for all members under the New York City Medicare Advantage Plus plan. So all members will have up to 12 routine foot care visits covered under the program. And routine foot care really comprises your toenail clippings and callus removal is what routine foot care is. And then finally, we have the care coordination, which is really led by our care management teams, which are led by case management nurses and care management nurses. If you're going through a complex situation like cancer treatment, there are a number of follow-up exams and tests and treatments that you'll need to coordinate. And that complex care management nurse is going to be working with your doctors and providers and helping ease everything through the plan. So they're really there to help and work as your healthcare advocate to work directly with your doctors. Kevin, you can move right on to the next slide. And you can scroll right into the last slide, which has the important dates and resources. I want to use this opportunity to kind of recap some of the things that we've reviewed through so far. First and foremost, the new scheduled effective date for the Medicare Advantage Plus program is April 1st. So as many of you know, there was a judge ruling that put a stay on the rollout of the New York City Medicare Advantage Plus plan. So we were not able to implement the program for January 1st of 2022, but the judge has scheduled a projected effective date for April 1st of 2022. So we are moving forward with the planned effective date of April 1st, 2022. The New York City Medicare Advantage Plus plan is the premium free base plan that will be offered through the City of New York. So if you choose to opt out of the Medicare Advantage Plus plan to stay on your current program, there might be a buy-up premium that you'll have to pay in order to keep that current program. On the Office of Labor Relations site, they have the rate sheets posted, both for the January 1st effective rates, and then they also have the rates effective for April 1st, 2022. So you'll want to look at the April rate sheet to determine what your buy-up premium would be for your current plan if you choose to opt out and stay in your current plan for April 1st. I will let everyone know that the buy-up premium for the GHI Senior Care Plan is $191.57 for the basic coverage, and then $2.83 for the 365-day hospital rider. So it's a combined premium of $194.40 per member per month. So if there is a husband, a retiree and spouse, that would be roughly just under $400 a month for the senior care premium that will come out of the retiree's pension each month. So I encourage everyone to review through the rate sheets to see what the buy-up premium will be for your current plan if you choose to opt out on April and stay in your current plan. Now, we will continue to hold general retiree education sessions through the entire month of through March. So you can access those general session meetings on the Empire blue.com/NYC-MA-plus website. It has a link to all of the scheduled meetings that we have taking place for February and March. And there's also an opportunity for you to click on a pre-recorded presentation and hear a lot of this again on demand. And I know that Doctors Council is recording this session, and they'll be sending it out as well. So you'll have an opportunity to review through all of this information. The opt-out period has been extended to March 31st, 2022. So you'll have an opportunity to opt out through March 31st. If you have already opted out, you do not need to submit another opt-out form. Your original opt-out will be honored. All members that have opted out through the middle of January will be receiving their opt-out confirmation letter. And those opt-out confirmation letters have started to mail this week. So the likelihood is you'll probably get your opt-out confirmation letter within the next week, I would say. You'll also have an opportunity to rescind your opt-out. So you can change your mind and go into the New York City Medicare Advantage Plus plan if you submitted an opt-out in the fall and now you think, you know, I'm going to give the plan a try, because you also have that extended switch period between April 1st and June 30th. So you can go into the New York City Medicare Advantage Plus plan for April 1st. And if you decide that you don't like it in May, you have an opportunity to go back to your original plan during that extended switch period. Now, I do encourage all members, all retirees, to go on the City of New York's Office of Labor Relations site, which is the nyc.gov/HBP. Click on the retiree tab, and it will bring you to all of the information that you need to review to make an informed decision. It has your frequently asked questions document, which has just recently been updated. It includes the plan comparisons for all of the programs. It includes the rate charts for both January 1st rates and April 1st rates. It includes access to a link to the full evidence of coverage, the prior authorization flyer. It also has a sample of the provider education information that we've been sending out to educate providers. That's one of the big components of rolling this program out, is outreaching to doctors so that they're familiar with what the New York City Medicare Advantage Plus plan is. Over 90% of the doctors that City of New York retirees have seen in the past 2 years are actually in-network contracted providers that participate in the plan. But many of the providers are not recognizing the name. They're hearing the Alliance, they're hearing New York City Medicare Advantage Plus plan. It's really the Medicare PPO plan for Emblem Health or the Medicare PPO plan for Empire Blue Cross Blue Shield. That's the network that these providers participate in. So you'll be able to view a sample of the provider education information on that website as well. Finally, I encourage everyone to call the Welcome Call Center if you have any questions that were not addressed tonight, or if you think of anything after the fact, and that's the 833-325-1190 number. So I want to thank you at this time. I will turn it back to Kevin, and I will be more than happy to go through all of the questions that were submitted and hopefully address every single question that everyone has.
Kim, thank you for walking us through that presentation. Just to remind folks, the purpose of tonight is to share information from Kim and her team. We are recording this. We also will send out the recording of this and the PowerPoint to people who RSVP. We'll get that out. Kim, we thank all the doctors who submitted the questions in advance. There are a fair number of them, so let's just dive into it.
Kevin, actually, there is one thing before you go into the questions. There's a few things that I just saw in the chat that I wanted to address that I forgot to address.
Please.
First and foremost, number one, Medicare Part B reimbursement, including the IRMA surcharges, will continue. So New York City retirees are eligible to get that Medicare Part B premium reimbursed from the City of New York. So just go on, if you're not receiving it, make sure you apply for that Medicare Part B reimbursement through the city, and that would also include the IRMA surcharges. If you are a retiree that has non-Medicare eligible dependents. Maybe your spouse is not yet on Medicare or you have underage children. Those non-Medicare eligible dependents will be covered under the GHI CBP plan. So that is the companion plan that goes along with the New York City Medicare Advantage Plus plan. So Kevin, take it away.
All right, Kim, let's just dive into it. A lot of questions. The first one is pivoting, which is some multiple questions. Can you comment on anything about out-of-pocket costs?
The out-of-pocket costs under the Medicare Advantage Plus plan, you do have that annual maximum out-of-pocket of $1,470. So once you've reached that under the Medicare Advantage Plus plan, you won't have to pay any additional co-payments.
Dental.
Dental coverage, there's very limited dental that's under the Medicare Advantage Plus plan. It's only Medicare covered dental, which is really primarily extractions due to cancer treatments. So for regular dental coverage, I know that they get that through the Union Welfare Fund, so that's not impacted by this plan at all.
Correct. Dental is available through the Retiree Welfare Fund. Can you comment on labs and testing?
Labs and testing, your lab work would be the $15 copayment, and that would include all the tests that one has done in that one lab order. If you have to go for an X-ray or a complex test like an MRI or CAT scan, that would be the $15 copayment as well. So for every separate office visit, separate service, it's the $15 copayment.
Prescriptions.
Prescriptions, you would have to look to the prescription drug, the enhanced prescription drug rider. So as I mentioned earlier, you cannot have an individual Part D plan alongside the Medicare Advantage program. You would need to purchase the Emblem Health enhanced prescription drug plan that's offered through the City of New York.
Mental health.
Mental health outpatient services are covered for a $15 copayment per office visit, or if you utilize the mental health benefit through Live Health Online, those Live Health Online virtual visits are covered at a $0 copayment.
Copays if I go to the ER or I see my primary care physician.
Primary care physician is a $0 copayment. Emergency room is a $50 copayment, but if you're admitted into the hospital within 72 hours, it's waived.
Okay. With traditional Medicare, Medigap, if a clinician accepts Medicare, then they must accept all Medigap plans, even if they did not accept Emblem Health as an employee health plan. With this MA plan, must all clinicians who accept Medicare accept this MA plan?
All clinicians that are recognized by Medicare, so all clinicians that are Medicare participating providers have the ability to bill the plan, and we will pay that provider the full Medicare allowable amount. But if it is an out-of-network provider that's not contracted in either Emblem Health, Empire Blue Cross Blue Shield, or the National Blue Cross Blue Shield program, they're not obligated, they don't have to take it, but they do have the ability to bill us directly, and we will pay that provider the full Medicare allowable amount. Now, if a member sees an out-of-network provider that is not willing to bill us, I want them to call us first so that we can outreach to the doctor. 9 times out of 10, it's really just educating the front staff as to how the program works. It's a passive PPO. They're still going to get paid the full Medicare allowable amount. And it's really just an education aspect. So we ask you, call us first, let us outreach. If they still say no and you pay up front for that claim, we'll reimburse the member directly the full Medicare allowable amount, less any co-payments.
How does the recently enacted surprise billing legislation affect this MA plan?
Under Medicare Advantage programs, members are always held harmless. So there's never going to be surprise billing under a Medicare Advantage program because the Medicare laws and rules that govern traditional Medicare apply to the Medicare Advantage program. So if they see a doctor in an emergency situation, the plan's going to pay that doctor. So the member is kind of held harmless.
With the development of independent practices within large medical centers, how can one be assured that the players in the system accept the plan? Each specialty offices, consultants, radiologies, labs, PT, etc.
Yeah, the majority of the time when you have these large practices, that many of them are affiliated with large hospital systems. The majority of the providers that are within that practice do participate in the network, so they follow the umbrella agency. However, there are some situations where you could have a large group practice where individual physicians are making individual network contract decisions. And that's where you need to confirm on an individual provider basis. You can do that either through the Find Care tool or calling our Welcome Call Center and having the representative look up the provider on your behalf. But I think for the most part, in my experience, most of the providers that are in a large group practice, for example, NYU Langone, all of those providers are in-network contracted providers. So in most cases, I think most of them would be.
Commenting on copays, the initial information was there was no copays for primary care physician. New information says there is one. Can you please clarify that?
There is no copayment for primary care physicians under the New York City Medicare Advantage Plus plan. There is a $15 copayment under the GHI Senior Care Plan, though.
There are copays for lab work. Is it per test? Say when there is a blood count, a chemistry test, thyroid test, other tests?
It's one single copayment that's done for the entire lab work.
Is there a maximum out of pocket for copays?
The maximum out of pocket would be the $1,470 under the Medicare Advantage Plus plan.
Regarding prior authorizations, if a study needs to be done urgently, same day, what happens?
There is an expedited urgent prior authorization process. So in a situation where a member needs something done on an urgent basis, the provider has the ability to fast track that prior authorization through an expedited authorization process. And it typically is done within 24 to 48 hours, depending on the urgency of what the member has to have done. So there is a process for expedited pre-auths.
I think there was a related question about guaranteed turnaround time for prior authorizations.
The federal government does have CMS mandated requirements surrounding prior authorizations. And the requirements are a little longer. I mean, the CMS required turnaround time is 14 days. We never take 14 days to do a prior authorization. It depends on what you need to have done. In some situations, the prior authorization is done immediately. In some situations, it takes a couple of days, but the average turnaround time for standard procedures is around 6 days.
Gotcha. Kim, as we all are aging, does this MA plan cover end-of-life care? Does it cover hospice and any in-home care services?
Hospice care is covered under the program. So the initial hospice consultation would be covered under the Medicare Advantage Plus plan, and then all further hospice coverage would fall under traditional Medicare. So the federal government is the one who pays for hospice benefits, but the Medicare Advantage Plus plan would also cover home care and all of the durable medical equipment that's needed in the home.
How does the MA plan affect the prescription plan?
The Medicare Advantage plan will affect individual Part D plans. So if you're enrolled in an individual Part D plan, that plan will be terminated as a result of the Medicare Advantage Plus enrollment. Now, if you're enrolled in the Emblem Health Enhanced Prescription Drug Rider, that's not going to be impacted whatsoever by this. So that will continue and will not be impacted.
Regarding opting out, if I sign up now for this program, what are the rules for opting out down the road? And can I get back into the traditional Medicare, Medigap program offered by New York City?
What will happen is you'll be automatically enrolled as of April 1st, 2022, and you'll have the ability to switch out of that plan if you choose to during that switch period from April 1st through June 30th. And then you'll also have another opportunity to make a plan change during the fall transfer period. So you will have those really 2 additional opportunities to switch back to, you can switch back to traditional Medicare anytime you want on a monthly basis, but you won't be able to get a City of New York medical plan except during that switch period or the fall transfer period.
Can you please describe benefits if one travels inside the US and if one travels outside of the US?
The inside the United States, you're covered for all medical services, everything that Medicare would cover. Outside of the United States or outside of the United States and US territories, you're only covered for urgent and emergency care. So you do have coverage outside of the US for urgent and emergency care.
If benefits are through my spouse who worked for the city, does a surviving spouse who is not a city retiree have the ability to continue coverage?
If the surviving spouse will be able to continue the benefits through the city of New York under the COBRA program, so they will be able to continue under COBRA and pay the full COBRA premium for the plan. For the New York City Medicare Advantage Plus plan, the COBRA premium for 2022 is $7.50 per month. And for 2023 and the next 4 years, the premium is $0. And COBRA's only for 3 years though, 36 months.
Under the changes for the retirees program, will I be charged a copay of $15 every time I call or see my doctor to get a medicine refill?
Every time you have an office visit where you actually see your physician and he bills for an office visit, you would be subject to the $15 copayment for specialist visits. If it's an office visit to your primary care doctor, there is no copayment.
If I want to keep my current insurance that I'm not charged for, will there be a payment I will have to make?
If you opt out to keep your current plan after April 1st, there will and could be a buy-up premium. So for example, if you're senior care and you opt out to keep senior care, the buy-up premium is going to be $194.40 per month. That's where retirees need to go to the Office of Labor Relations site to look at the rate sheet to see what your applicable buy-up premium would be for your specific plan if you opt out after April 1st.
Will the new Medicare Advantage plan cover us in a foreign country?
You'll be covered for urgent and emergency care in a foreign country. The plan, you would not be eligible if you permanently reside outside of the United States in a foreign country. So the plan covers urgent and emergency care only.
Question comes, my wife and I completed OPT opt-in online on October 1st of 21. Do we have to do it again since the deadline was extended?
Those retirees that have already submitted an opt-out do not need to submit another opt-out. Their original opt-out will be honored.
This person is saying that may not have received any acknowledgement that they filed for opt-out. How do we know that the opt-out, you received the opt-out like that they did online?
The opt-out confirmation letters were mailed this week, so they will receive an opt-out confirmation letter.
Does it cover all the states in all the states of the USA?
Yes, the plan is a national PPO program, so it covers you in all 50 states and US territories.
Got you. I officially retire on February 10th of 2022. Congratulations to that person. And signed up for the New York City Medicare Advantage Plus program, which doesn't start till April 1st. What should I do?
Because the Medicare Advantage Plus plan was not rolled out for January 1st and has been pushed to April 1st, that retiree is going to be enrolled in the senior portion of whatever plan they were in before they retired. So I'm assuming it's probably the GHI senior care plan. So they'll be in that plan until April 1st, and then they'll be rolled into the Medicare Advantage Plus plan.
Do I need to take a supplemental insurance policy or additional drug coverage?
You do not need to take purchase an additional supplemental policy. There's no need for that. But you will need to purchase a prescription drug plan through the enhanced prescription drug rider that's offered through Emblem Health through the city of New York.
Do I still have the freedom to see my current physician?
You have the ability to see any Medicare participating provider. So you'll have access to any doctor that is recognized by Medicare.
What's the best way to have the information regarding the current health insurance for retirees versus the new Medicare Advantage Plus?
The best way is, the information that was mailed to you in the pre-enrollment guides had a side-by-side comparison between the programs, and also on the Office of Labor Relations website, they have the side-by-side comparisons. So you can look at how your plan compares. I encourage them to go right to the website.
And they can find there the information regarding retirees' health insurance for family members?
Yes.
Will those of us who haven't retired yet have any choice, or are we, does a person have to participate in the Medicare Advantage Plus plan?
For those who have not retired yet, on a go-forward basis after April 1st, you'll have the ability to choose between the GHI Senior Care Plan or the New York City Medicare Advantage Plus plan upon retirement.
I read in the brochure that Medicare Advantage that we can be covered overseas. Is that true?
For urgent and emergency care.
Got you. Can you comment on the prescription plan for GHI Senior Care and compare it with whatever plan you have in the New York City Medicare Advantage Plus plan?
The GHI, the Enhanced Prescription Drug Rider that's offered through Emblem Health, is the prescription drug plan that will go along with either the senior care plan or the New York City Medicare Advantage Plus plan. So that is the prescription drug rider that will go with either one of those plans.
Got you. In traditional Medicare, the overhead is low and costs to the beneficiaries are known and published. MA may be a private for-profit enterprise. What's to keep from rates being raised at the beneficiary's expense?
The New York City Medicare Advantage Plus plan has a guaranteed 5-year contract with the City of New York. So the current benefit structure that's in place is guaranteed. So the co-payments will not increase and the premiums are guaranteed for that 5-year period. So the length of the contract, it's guaranteed.
Since it's in the clinician's office that has to do all the work in getting approvals, does this add to the cost of care in the clinician's office, personnel needed and time, and the scheduled payments of clinicians for service being lower? Is it a disincentive for the clinician to provide good care? And why is MA a better option?
Yeah, that's a complex, difficult question for me to ask. I mean, many of the requirements that fall under the Medicare Advantage program are similar requirements that fall under many of the commercial programs that these providers participate in. So the same process and rules apply in regards to the mechanics of how they submit prior authorizations. Now, what I can tell you is for an out-of-network provider, we're paying that provider the same Medicare allowable amount. For in-network contracted providers, most of our contracts are very close to Medicare. So most of these providers are getting paid the same amount that they would be receiving through traditional Medicare. But as I said, for most providers, many of them participate in multiple different commercial insurance contracts and networks. And this is the same process that most carriers follow.
Is retiree health insurance eligibility dependent on length of employment with the city? I have worked for New York City Health and Hospital since October 26 of 2015.
I am actually going to defer this to one of my colleagues that might have this information. I do not know the answer to that. Anne, Kathy, Marlon, do any of you know if there is a requirement for years of service to receive medical benefits through the city? I don't know if they can unmute themselves.
I've asked Marlon and Kathy to unmute.
I would defer that to Kathy. From my understanding, there is, I think some unions have a minimum that they lay out, and I don't know if it's done specifically across the board with the city, or it's specific to unions. So
the answer is no.
I was just gonna say,
there's no minimum. Yeah.
there you go, Chris, go. Okay, perfect.
Why should we choose this Advantage plan, having to pay $125 a month for prescription, if other Advantage plans do not have this expense with the same drug coverage? Example, AARP.
You know, the difference here is the federal government does not permit members to be simultaneously enrolled in both the group Medicare Advantage plan and an individual Part D plan or an individual Medicare Advantage plan. In order for members to be eligible for the Medicare Part B premium reimbursement from the City of New York, you have to be enrolled in a qualified City of New York plan. So if you choose to go out on your own and enroll in an individual Medicare Advantage plan through United or another company, you will lose your City of New York benefits and you will lose the Medicare Part B reimbursement. So that is that's probably the biggest advantage, is staying within the city medical benefit program to get that Part B premium reimbursement.
Next question. With this new plan, you can see an out-of-network provider at no extra cost. I'm wondering, is there any disincentive for an out-of-network provider to accept this plan? For example, will they get reimbursed less than with traditional Medicare? Traditional Medicare generally does not require prior authorizations for services. Can you elaborate on how requiring prior authorizations with this new plan may delay services and care? As a practicing physician, it was often very difficult and time-consuming to get prior authorizations with certain insurance plans.
If it's an out-of-network provider, that out-of-network provider is going to be paid the full Medicare maximum allowable amount that they're receiving today. So they're going to get paid the same Medicare maximum allowable amount. And if they're an out-of-network provider, they're not obligated to get prior authorization up front, but the claim will be retrospectively reviewed as it is with traditional Medicare today.
Next questions. Currently, someone's paying $300 to Emblem Health for my husband and I. Do I still pay that every month if I'm in this new plan?
That $300, I'm assuming, is the cost of the enhanced prescription drug rider, which was $150 and change for 2021. So the new premium is going to be $125. So this particular retiree will be paying the $250 every month will come out of their pension to cover the prescription drug rider, and that will continue.
We pay more than $1,000 to Medicare between both of us. Do we still pay that amount to Medicare?
All members will continue to pay their Medicare Part B premium each month, and that comes out of their Social Security check each month. That will not change. So that process will continue, but members also have the ability to submit to the City of New York to get that Medicare Part B premium reimbursed to them. And the premium is based on income. So if you're at a certain income threshold, you might have a higher Medicare Part B premium than others, and the City of New York will reimburse the IRMA, the surcharges as well.
Yeah, but the standard premium for Part B right now for 2022 is $170.10, and then it goes into kind of the income basis, just like Kim said.
Thank you. Thanks, Marlon. Does Medicare Advantage have greater utilization reviews and prior authorization requirements than regular Medicare?
It's just different. As I mentioned earlier, the prior authorization and review process is done on the front end. Under traditional Medicare, it's done retrospectively on the back end. So it's the same guidelines. It's just the timing of how they do it is different. One's on front and one's on the back end.
If you decide to switch back to regular Medicare, will your request be reviewed for pre-existing conditions? And would you be at risk for not being allowed to return to Medicare or allowed to return at higher premiums?
No, you'll be able to switch back to Medicare without any worry about a pre-existing condition or evaluation. So you'll be able to switch back without any of that concern.
I was wondering if any money will be coming out of my Social Security check under the new health plan.
Your Medicare Part B premium currently comes out of your Social Security check, and that will continue. That will not change. So that process will continue.
I'm retiring in August of 2022. Currently, I have Emblem Health GHI CBP. Will I automatically enroll in New York City Medicare Advantage Plus plan on my retirement?
What will happen is you'll have the choice between the New York City Medicare Advantage Plus plan or the GHI Senior Care plan and pay the buy-up premium.
If I do not like the New York City Medicare Advantage Plus, can I change to another plan during the open enrollment period?
You'll have the ability to change back to your current plan during that switch period, which is April 1st through June 30th, 2022. And then during the next fall transfer period, you will only have an opportunity to choose between the senior care plan or the New York City Medicare Advantage Plus plan.
Who will pay for Medicare Part B premium, Social Security or Medicare Advantage plan?
The Medicare Part B premiums come out of the member's Social Security check each month. So the member will be paying that Medicare Part B premium, they could submit to the city for reimbursement of those premiums. So they are not paid by the plan.
My question is about drug coverage through Medicare Part D. Do I have to disenroll from Medicare Part D when I join the Medicare Plus plan? I pay $38 a month for my drug plan, and how much will I have to pay with Medicare Plus plan?
When you enroll in the New York City Medicare Advantage Plus plan, you will then have to pick up the enhanced prescription drug rider through Emblem Health. And that plan is $125 per member per month. That individual will not be able to keep that individual Part D plan because the government does not allow you to be enrolled in a group Medicare Advantage, an individual Part D at the same time. You need to be on a group sponsored Part D plan, which is the Emblem Health Enhanced Prescription Drug Rider.
Gotcha. There's a reference or a question about $15 copay. Is that for seeing particular doctors?
$15 copayment applies to specialists. Primary care physicians is a $0 copayment, and that's under the Medicare Advantage Plus plan. Under senior care, it's $15 for all office visits.
Could you, I know we discussed this, but could you touch upon how does prior authorizations through MA differ from regular Medicare?
Basically, as I said earlier, the difference is one's done through a prior approval on the front end, and one is done on a medical necessity review retrospectively on the back end after their claim was rendered.
Is New York Presbyterian Columbia Division covered under the Medicare Advantage Plus plan?
Yes, all New York hospitals are in-network contracted hospitals in the network.
My question is, if as of now I only have Medicare, how can I qualify for the new insurance plan?
You need to contact the Office of Labor Relations and fill out a health benefits application in order to get your medical benefits through the City of New York if you're a City of New York retiree.
Next question. I will be retiring soon. Will be eligible for Medicare in July. Currently receiving specialty medication through Acrodo Pharmacy and is sent or administered in MD office. Currently out-of-pocket expenses as an employee. How will that change when I enroll in the Medicare Advantage plan?
For the specialty drugs that the member's getting through Acredo, the likelihood is they're probably Medicare Part B as in boy eligible drugs, which means they would be covered under the medical plan. If they are covered under the medical plan, they'll be able to get those drugs covered at a $0 copayment. So that's how the Medicare Part B covered drugs would be covered. If it's a drug that falls under Part D, it would fall under the Emblem Health Enhanced Prescription Drug Rider. But because they're getting it administered as an injectable in the doctor's office, I'm pretty confident it falls under the medical as a Part B drug for a $0 copay.
Please address the following questions applicable to retirees who have opted out and wish to stay in their original senior K plan. The total monthly cost.
If a member opts out to stay on senior care, the premium after April 1st will be $194.40 for the basic and hospital rider combined, and that's per member per month.
Whether Medicare Part B will continue to be reimbursed.
Medicare Part B will continue to be reimbursed by the City of New York.
Whether they will continue the benefits from Doctors Council Welfare Fund for dental and optical and healthcare cost reimbursement. Yes, the benefits from the retiree welfare fund through Doctors Council are not impacted by this. Next question. If I'm traveling, what services are covered outside of the US?
Urgent and emergency care.
Gotcha. How much will it cost per month to keep my present Medicare coverage? I've opted out already. Will there be a change? I've opted out already.
They need to refer to the April 1st rate sheet to see what the buy-up premium is. I don't want to assume they're senior care. If it's senior care, it's $194, but if they're in another plan, there could be a different premium. They need to go to the Office of Labor Relations website to look at the April 1st rate sheet.
Next question. My wife and I opted out of Medicare Advantage Plus plan online on January 9th of 2022. We've just received documents from the New York City Municipal Committee regarding prescription drug coverage for New York City retirees. Since we've opted out, does this information concern us?
No, you could ignore that information. That's not applicable to them because they're opting out, so they don't have to worry about it.
Do we have to do anything since we're staying with the original plan?
Nope.
Are we supposed to receive an official confirmation that we remain in the original plan and keep our current prescription drug coverage?
If you've opted out, you'll receive a formal opt-out confirmation letter in the mail during the month of February.
What are the key changes costs for the issue of extended healthcare insurance for Kings County Hospital retirees?
I don't understand that question.
Right. I think you've covered it in other aspects about comparing back and forth. If that doctor has a particular follow-up question, please get a hold of me. Does Medicare Advantage Plus plan cover outpatient physical therapy? I was informed that a particular therapy clinic would not take patients with Medicare Advantage plan. They'll take patients with primary Medicare.
Outpatient physical therapy
I
is
was
covered under the
thinking something
program. It
else.
would be a $15 copayment. And specifically to that doctor's question, I've already reached out to our network team for them to outreach to Ivy Rehab Physical Therapy. Ivy Rehab is a national chain, and many of their offices do participate and are in-network providers. The Hartsdale location does not appear to be, so we are outreaching to that facility, that practice, to educate them on how the billing works and how they can bill the plan directly, and that we will pay them the same Medicare allowable amount. So we're outreaching to that practice now.
Can you comment on the following question / statement? I have a special situation in that I have Emblem Health GHI as my secondary after Medicare and Empire United Healthcare as my tertiary insurance. My prescription coverage is with Empire. My wife, who does not have Medicare yet, is covered under both plans. If I choose to opt in, I'll have to pay about $125 a month for each of us for drug coverage, and we'll both lose our tertiary coverage since once I opt to join a Medicare Advantage plan with the drug plan, Empire terminates coverage. If I opt out, I have to pay the monthly fee, if he recalls correctly, $191 a month to keep my current coverage for me as well as my wife, including our prescription plan.
This is specifically to a New York State retiree or New York State employee that I can tell is enrolled in the night shift plan, which is called the Empire plan. So you'll be able to continue to keep the night shift plan, and you'll be able to utilize the night shift plan for the prescription drug coverage. So that will not be terminated. We have already confirmed with New York State that you have the ability to be enrolled in the Medicare Advantage Plus plan and keep the night shift plan as your secondary coverage, and that can be utilized for your prescription drug benefit. So this particular couple does not have to purchase the enhanced prescription drug rider. You can utilize the night shift plan as your prescription drug coverage in this case.
With regards to our Medicare now, we were supposed to have Part D, otherwise we'll be charged our fee regularly, even if we have drug coverage through Emblem Health. With the Medicare Advantage plan, it says we won't need Part D. What happens if we did not like the Medicare Advantage plan and would like to go back to our old Medicare? Should we have Part D again? And will we be penalized for not having Part D while on the Medicare Advantage plan?
You'll always need to have Medicare Part D, or you'd be subject to the penalty. So if they're currently enrolled in the Emblem prescription drug plan, which is a Part D plan, they'll continue to be enrolled in that prescription Part D plan through Emblem Health. That will not change based on the New York City Medicare Advantage Plus plan.
Do retirees get Medicare Part B standard as well as IRMA premium reimbursement if I opt out of Medicare Advantage Plus plan and stay in the current plan?
Yes, as long as you're enrolled in a qualified City of New York medical plan, you're eligible for that Medicare Part B reimbursement, including the IRMA.
Do retirees get Medicare Part B standard as well as IRMA premium reimbursement with Medicare Advantage Plus plan?
Yes.
Will the providers in the new plan accept all patients with traditional Medicare?
The plan will pay any Medicare recognized provider. So if they're an in-network contracted provider, they are obligated to see members, but if they're an out-of-network provider, they're not obligated to see any patient. but we would pay that provider the full Medicare allowable amount.
How are the providers in the new plan being enlisted? To date, what percentage of providers currently accepting traditional Medicare are enrolled in the new plan?
It's not a new network. It's basically a plan that the city of New York is offering that's linked to a current network and a current product. So the current providers are participating in Emblem Health's Medicare PPO network, or Empire Blue Cross Blue Shield's PPO network, or the National Blue Cross Blue Shield Medicare Advantage PPO network. So it's not a new network where we're soliciting new providers to participate in. These are existing providers that are contracted with this program already. And currently today, over 90% of the doctors that City of New York retirees have used in the last 2 years are actually in-network participating providers.
Will payment for services be equal or better than traditional Medicare rates?
We'll pay the Medicare providers the full Medicare allowable amount up to the maximum Medicare billing limit. So if a provider is a Medicare provider but does not accept assignment, we will pay that provider up to the full 115% of the maximum Medicare billing limit.
Will there be pre-approval for services similar to current Medicare Advantage plans?
Yes, the prior authorization process is very similar amongst all Medicare Advantage plans.
Next questions. What is the difference between Medicare Advantage plans and Medicare supplemental plans?
A Medicare Advantage plan is a plan that contracts with the federal government to administer Medicare benefits. So it covers Medicare and secondary all rolled into one. So the plan becomes the administrator of the Medicare coverage. A Medigap or a Medicare supplement plan pays secondary after traditional Medicare pays.
How many providers are in the Advantage plan network?
There's over 1 million individual provider records that are in the Medicare Advantage network. So that accounts for providers that could be in multiple locations. So if we're looking at provider records, it's over 1 million. But if you want to look at actual individual providers or belly buttons, if you want to call them that, it's over 640,000 participating nationally.
How many providers accept Medicare Empire related plans?
The Empire Medicare related plan is a supplemental plan that pays after Medicare. So basically the Empire Medicare related plan members would have access to any Medicare provider.
Is a referral required to see a specialist?
Referrals are not required to see a specialist.
Next question. I am thinking of opting out of the Advantage Plus plan. What are the pros and cons of the decision? Do I still get reimbursed by the city for Medicare B? I have Medicare D with the company of my choice other than Emblem. Can I stay with that?
You need to, that individual is going to have to sit down and evaluate all of the information to determine what's the best decision for them. They can opt out. If they choose to opt out to stay on their current plan, they will probably have to pay a higher buy-up premium, but they'll be able to keep their individual Part D plan if they choose to do that. If they don't opt out, they're going to have to purchase the enhanced prescription drug rider. So they really need to evaluate that on an individual case-by-case basis to find out what's best for the individual member.
If I completely drop out of the city health plan, what do I lose? How does it impact me? Does it affect my pension anyway?
If they waive their coverage from the city, they will no longer be eligible for that Medicare Part B premium reimbursement. So they lose that.
There's a question about how does it affect my Doctors Council retiree benefits? It does not. At the end of December 2021, I had sent in a request to stay in the Advantage Plus plan. What steps do I take to opt out of it now?
See, I totally understood this question. So they wanted to go in the Medicare Advantage Plus plan, and now they are deciding that they want to opt out. So if they want to opt out, they need to call the call center and tell the representative that they want to opt out. And then they would stay on the current plan that they're enrolled in today, which I'm assuming is senior care, but they'd be responsible for that buy-up premium.
Got you. Then there's another question about Ivy, the Rehab Physical Therapy Outpatient Clinic in Hartsdale, New York, that might be,
That's the same question that was submitted earlier. Yeah, that particular practice we're outreaching to.
okay. Couple more questions received from the doctors. Does the spouse and retiree have to be on the same plan?
Yes. So that you have to make the same decision. The retiree and spouse go together as a package deal. So one cannot opt out and the other one go into the new plan. You have to make a decision as a couple as to what plan you want to be in.
Will the spouse premiums be paid from employee deductions just as the employees?
The premiums will be deducted for both the retiree and the spouse directly from the retiree's pension.
Does the spouse need to notify NYCers when Medicare becomes the primary plan in order to stop premium payments on the spouse's regular insurance?
You know, I may need to follow, I'm not sure if I'm understanding that. I'm assuming that the NYCers plan is affiliated with the New York State retirement system. So I need a little more clarification as to what they're exactly asking on that question. So whoever sent it in, I need a little more clarity.
The doctor who sent it in just a little while ago, just feel free to give me an email. What has been the price increase history of offered plans?
It's tough to say. I can't comment on all of the plans and what the premium increases have been. What I can tell you is the New York City Medicare Advantage Plus plan, the premiums are guaranteed for the 5-year contract. So it's going to be zero premium for retirees, guaranteed for the next 5 years.
Should we move to Florida, will the plans be applicable down there?
The plan is a national Medicare PPO, so it covers you anywhere in all 50 states or US territories. So yes, Florida is covered.
What cast in stone deadlines exist?
The opt-out deadline for the transfer period, this opt-out deadline is March 31st, 2022. So that's the deadline for the opt-out. And then the extended switch period is running from April 1st to June 30th. So June 30th, 2022 is the last date to make a switch. So those are the two deadline dates.
Gotcha. Is there a side-by-side comparison chart available?
On the Office of Labor Relations site, there's side-by-sides for all plans.
Right, and then we've also sent the link out to get to that to the folks via email. Kim, that if you want to grab a breath, that takes care of the submitted questions that we received. I'm now going to pivot and to the questions in chat. I'll also rely upon your colleague Marlon and anybody else who I think may have been answering some questions in chat as it goes along. So if I ask a question, Marlon or anybody, please feel free to chime up and say it's already been answered. And thanks everybody for bearing with us as we are again trying to get information shared to the folks. There are published data on denial rates from Anthem that are high in 30% range. Can you comment on denial rates?
Did they say what? They didn't say 30%.
In parentheses, it says 30% range, right?
There is no 30% denial rate under the Medicare Advantage program. I can't really comment on where they obtain that figure, but I can guarantee you that that is not a legitimate figure. The program's overseen by CMS and Medicare, so it's a highly regulated program. We couldn't deny 30%.
Gotcha. Is the presentation going to be posted? This is going to be emailed out. The video and PowerPoint presentation will be emailed to everybody who is on this and who RSVP'd. Scrolling down. The Medicare Advantage plan seems to have a number of nice benefits: nationwide acceptance, international acceptance, just some concern about Part D coverage and the cost of that costing more than the pre-retirement GHI PPO pharmacy benefit. Can you just comment on that?
You know, the program and plan designs are determined and negotiated by the City of New York and the MLC. So the fact that the post 65 or the Medicare pharmacy benefit is different than the active or early retiree, that's all been negotiated, and the enhanced prescription drug rider follows the Medicare Part D parameters. So that's why it's different.
What is a health plan deductible?
Health plan deductible would be the deductible that the first dollar amount that the member would be responsible for the beginning of the plan. So for example, the health plan deductible under the New York City Medicare Advantage Plus plan is the first $253 of medical services the member would be responsible for. Under the senior care plan, they would have the $233 Part B deductible, and then the $50 plan deductible that they would have to be responsible for. So when I say one plan deductible for 2022, it means that you won't have to pay your Medicare Part B deductible and then have to pay the New York City Medicare Advantage Plus plan deductible. You'll only be responsible for the one. So you're not going to be double hit with a deductible.
Does this Medicare Advantage plan include Part D, i.e. prescriptions?
You would have to purchase the enhanced prescription drug rider through Emblem Health. That is the Part D prescription drug benefit.
I'm 59, retiring on April 1st of 22, currently covered by Aetna. How does this apply to me, knowing that I tried to apply before to Blue Cross Blue Shield, but it was not accepted in Somerset County where I live?
If they're 59 and they're not on Medicare, this would not apply to them. So they're not eligible unless they're Medicare eligible.
How can the MA plan be able to provide more benefits to retirees than the senior care plan without a higher premium? Will this be financially sustainable?
The program is funded by the federal government, so that's how we're able to offer all the additional enhancements and benefits under the program, because the majority of the premium is actually coming from the federal government. So that's why we're able to offer more benefits for a lower premium. And it's guaranteed for the 5-year contract. And Medicare Advantage plans have been around for the past, I would say 30 years, but it's well over 30 years. They've been around for a long period of time, but they've been very stable for the past 30 years.
Which kind of segues into the next comment or question about recognizing that there seems to be a list of extra benefits. How does the MA plan save money, and is there anything cut?
Once again, the majority of the funding comes from the federal government, but what it really comes down to is really helping members access benefits, access care. So for example, offering the incentives for the wellness and preventive screenings, it saves the plan money if members have preventive screening done on the front end and catch an illness before it turns into a high cost item. And it also helps the plan when we have programs in place that help members manage their chronic conditions better. So all of the additional programs and enhancements that we offer, many of them are focused in on members improving their health and health outcomes, which at the end of the day improves members' health, but also saves money because members are managing conditions better. So it's a win-win situation in regards to the additional programs that are offered to really help members.
How does the MA Plus plan compare with the Empire related plans?
They're different. The Empire Medicare related plan pays secondary to Medicare, so it's a supplemental plan. So it's a different program.
Will NYCers continue to reimburse for Part B and D premiums and IRMA?
The city of New York will continue to reimburse the Medicare Part B premium and IRMA. I don't know if they're NYCers, if they're talking about the state of New York or not. I'm not sure.
And a question about, is it deductible for MA per person or per family? I think it was answered that it's per
person.
Right. If we have traditional Medicare, AB and Medigap, do we need any NYC health plans?
If they have traditional Medicare and a Medigap plan, so they have traditional Medicare and a Medigap, It sounds to me that they might be doing something on their own and don't get their coverage through the city of New York, I'm assuming. I would think that you would want to get your benefits through the city of New York if you're eligible for it, because that would entitle you to your Medicare Part B premium reimbursement and allow you to get the New York City Medicare Advantage Plus plan for 0 premium.
Please compare in-network MD visit costs with senior care versus out-of-network MD visit with this Medicare Medical Advantage plan.
The Medicare Advantage program is a passive PPO, so the in-network and out-of-network cost shares are exactly the same. So when members see their primary care doctor, whether it's an in-network or out-of-network doctor, it's a 0 copayment. If they see a specialist, it's a $15 copayment.
I think there's a question that was answered. Some Medicare Advantage plans cover urgent medical care out of the country. Does this plan do so? I think Marlon answered. It covers emergency and urgent care that are out of the country when traveling. Can we get a copy of the video and PowerPoint? The answer is yes, covered that. Can one of the Empire representatives address the individual Empire related plans as they are delineated individually on the OLR website?
There's a few different Empire labeled programs. So you have the New York City Medicare Advantage Plus plan, which is the program that I went over this evening. And then you have the Empire Medi Blue PPO program, which is the existing Medicare Advantage program that Empire Blue Cross Blue Shield currently offers today for City of New York retirees. For those retirees that are in that Medi Blue plan, it would make sense just to roll into the new New York City Medicare Advantage Plus plan. Then there's also the Empire Medicare Related, which is a supplement after traditional Medicare. So that's a Medicare supplement type of program, very different. Traditional Medicare pays first, and then the Empire Medicare Related pays secondary. So it works similar to how the senior care plan pays as a supplemental plan. And then you have the non-Medicare eligible Empire programs that are out there. So you have the commercial plans that are not for Medicare retirees. That would be for the non-Medicare eligible retirees or non-Medicare eligible dependents.
Does a senior care plan cover ER urgent care when out of the country? I think you've answered that.
Yeah, traditional Medicare does not cover you outside of the United States. So if you're under senior care and you have a claim outside of the country, Medicare does not cover it. And when you submit it to the senior care plan, they will apply the out-of-network fee schedule and you'll be reimbursed just a very small fraction of what the cost of that service would be. So the coverage is really, really minimal, very, very, very minimal.
Question to Doctor's Council, is the $125 Part D premium count towards the $1,000 yearly unreimbursed medical expenses plan? And Dan?
Yes, any premiums paid that are not reimbursed by the city are eligible under the healthcare cost reimbursement.
Thank you. I would like to have more details about the ER urgent care with traveling enhancement.
It basically, if you have an urgent or emergency situation outside of the country and you have an urgent claim or emergency claim, it will be covered under the program. So it follows the same emergency guidelines when you're within the country. So the same rules would apply. So it would be treated the same way outside of the country as if you were inside the country. You'll pay a $50 copayment for emergency room visit. You would pay a $300 copayment for an inpatient hospital admission, or you would pay $15 for an urgent care visit.
Can member and spouse make different elections?
They cannot. So a member, a retiree and spouse come as a package deal. They both have to make the same plan decision. So they have to be with the same carrier.
Is there any coverage for healthcare received abroad? I think you've answered that.
Urgent and emergency.
I'm turning 65 next summer, but not retiring. Should I enroll?
If you're not retiring and you're still actively employed, you'll stay on under your active coverage until the time you retire. So you don't have to do anything.
What about if my spouse retires before me?
if your spouse retires before you, your spouse will continue to be covered under your active health plan until you retire. So you do not need to take action until your retirement.
What if one is not Medicare eligible?
If you're not Medicare eligible, this presentation doesn't really apply to you until you become Medicare eligible. So this is only for Medicare eligible retirees and Medicare eligible dependents.
What if I need an expensive drug?
It depends on what plan you're referring to. So if it's a Medicare Part B as in boy drug, it would be like an injectable drug. It would be covered under the medical plan, and that's a zero copayment for that Part B drug. Or if it's a prescription drug plan, prescription that falls under the Part D plan, it would be covered under the enhanced prescription drug plan. And that plan has a 25% coinsurance for each of the tiers.
And I also see Kathy from your team had typed in, if you need an expensive drug and have the Emblem Health optional rider, you can contact Emblem Health and find out how that drug will be covered. You should have handy the drug name and strength, and we will be able to assist you. Is senior care going to be phased out?
At this point, no, I do not anticipate senior care being phased out, but that would be a decision of the City of New York and the Municipal Labor Committee. But as of right now, not in the foreseeable future, no.
I'm just going to pause for a quick 10 seconds. Doctors, if there's any question or anyone hasn't spoken up, please, I'm going through these questions with Kim. Please type it in the question in the chat area and I'll get to it. That'll be your opportunity to ask anything that hasn't been covered already. So now that I've done that public service, now let me bounce back in. You may have already gone over this. What if I live in a distant state such as New Mexico or Colorado?
The plan, it covers you in all 50 states in the country. So New Mexico and Colorado are part of the plan, and there are in-network providers that participate in those states. So they're covered there.
What percentage of participants have opted out?
It's tough to say. It's less than 10%. So the majority of members have not opted out. They want to be enrolled in the New York City Medicare Advantage Plus plan.
How much is the Medicare B reimbursement?
It depends on the Medicare Part B premium that you're paying. The basic premium is $170.10. If you have a high income, it could be higher than that. And that's called the IRMA, income related surcharges. So you'd be reimbursed for that additional Medicare Part B surcharge. And that comes from the City of New York.
Does a physician have to be screened by a nurse and get their approval before they speak to a physician for clinical help utilization review?
It depends on the service. Sometimes in some situations, they may be connected directly to the medical director or the medical doctor that specializes in their specialty. So what they do in regards to review and prior authorization, we connect the medical provider specific specialty type to another specialty, the same specialty type. So, a cardiologist will be talking to a cardiologist so that they're of the same specialty. So it depends. It really depends on what they're reviewing, but they can get to speak to a medical doctor.
I go to in-network doctors of GHI Senior Care now in New Jersey. If I choose Medicare Advantage Plus, will I be able to see the same doctors?
The doctors in New Jersey, as long as they're Medicare participating doctors, they can continue to see them. But the network in New Jersey is affiliated with Horizon, Blue Cross Blue Shield of New Jersey, and that Medicare PPO network. So the likelihood is many of those doctors are probably in that network.
Can my husband continue to use my union benefit for drugs and still get medical coverage through the New York City Advantage Plan?
Yes, if you're getting prescription drug coverage through another union welfare fund, you can continue to do that and continue to get the prescriptions through the union. And then you can be enrolled in the New York City Medicare Advantage Plus plan, yes.
Do you have to be a Blue Cross Blue Shield member to be eligible for this plan?
Well, you have to be a city of New York retiree that's Medicare eligible in order to be eligible for this plan.
Is Blue Cross Blue Shield accepted in Somerset County, New Jersey?
Yes.
Can you explain the cost for expensive injectable drugs when I self-inject?
You know, there is something called a Part B versus Part D determination. And I can't give a blanket answer because I don't know what the drug is. So if it's a Medicare Part B as in boy, it would be covered under the medical plan and it would be zero copayment. But if it's a self-injectable that's considered a Part D as in dog drug, it would fall under the Emblem Health Enhanced Prescription Drug Plan. And you could call Emblem Health and give them the name of the drug, and they can tell you if it's a Part B or Part D drug, and they'll let you know what the cost would be.
Does Medicare Advantage plan cover acupuncture?
Medicare Advantage covers acupuncture because it's a Medicare covered benefit now, and it follows the same Medicare coverage guidelines. So acupuncture is covered for pain management in certain instances. So there is acupuncture, and I believe it's a $15 copayment for acupuncture.
And
If
they can get additional information. I think a lot of these questions, I think we've had this with other unions, and it's helpful to kind of show where retirees can navigate to get additional information. So Kevin, I'm gonna just, if you don't mind, I'm gonna share my sharing the screen, you know, or do you really want to go through all the questions? Because a lot of the information, like they can get the letter that was sent out by the city, they can get their benefit enrollment guide, the benefit summaries, and the comparison depending on what plan they are on, is that NewYorkCity.gov HBP website. But it's up to you. If the members want to go there directly, they can, but it's easier just to see it sometimes.
That's fine. That what you referred to, that link, we've sent it out a couple of times in the emails we sent out to folks.
Yep.
If they
Yep.
hit it, it takes them to that page and it has a whole thing.
Then
spelled out.
perfect. Then we don't need to do that.
Thank you. If one sees an out-of-network provider, can they balance bill beyond the contracted Medicare rate?
No, that's actually a great question. The Medicare maximum billing laws apply to providers, whether they're seeing a member under traditional Medicare or a Medicare Advantage plan. So if they're a Medicare provider, the most that Medicare provider can bill if they accept assignment is the full Medicare allowable amount. If they don't accept assignment, the most they can bill is 115% of the maximum Medicare billing limit. They are not allowed to balance bill above the 115%, and the plan will pay the full 115% to that provider that does not accept assignment.
If payments from the MA plan are the same as in traditional Medicare, how does the plan cover all the admin costs without saving money by denying services?
By actually coordinating and helping members manage their care and their chronic conditions better. So by really focusing in on the wellness aspect, we're able to help members manage care better. And that in turn saves money because members have better health outcomes.
I thought the prescription drug program was optional. Does Doctors Council have an RX program? Doctors Council does not. Isn't it true that the Advantage programs can change benefits yearly as opposed to Medicare, which offers stability and benefits?
The program, the benefits themselves are actually negotiated by the City of New York and the MLC, which is the Municipal Labor Committee, and they're guaranteed for the 5-year contract, so they're not changing. So the benefits and plan designs has been negotiated and are not changing, they're guaranteed. The only thing that could change is if traditional Medicare adds a benefit to traditional Medicare, we're required to add it into our plan. So there will only be additions to the program. A good example is the addition of acupuncture. That was a new benefit that was added in 2021. We had to add it into our plan. So we're not going to take away any benefits, guaranteed for the 5-year contract.
If I die, will my wife be eligible for a supplemental plan?
The surviving spouse will be able to continue coverage under COBRA for the 36-month period through the city of New York and pay the COBRA premium.
Does the city of New York pay Medicare premium and the surcharge is based on income?
The city of New York will reimburse the Medicare Part B premium and the IRMA surcharges, yes.
There's a comment on the wonderful presentation that you and your team are making. If one comes out of the New York City Health Plan, does it have an effect on the pension?
If they come out of the New York City Health Plan, they will not be eligible for the Medicare Part B premium reimbursement.
There was another comment upon an effective, appreciated presentation. There's a question again about, is Part D premium $125 a month reimbursable from Doctors Council under $1,000 reimbursed expensive? We answered that question, yes. I will be 65 soon and still working. Do I need to get Medicare when I turn 65?
If you're still working, you'll automatically get Medicare Part A when you turn 65, but you do not need to apply for Part B until you retire.
It seems that as long as you're healthy, Advantage works, but illness can occur many unforeseen co-pays. That's my understanding of researching consequences of signing up for an Advantage program.
Well, under the senior care program, I have to remind all members, there's a $15 copayment for every service. So every office visit that you have, whether it's primary care doctor or specialist, you'll be subject to the $15 copayment. Under the Medicare Advantage Plus plan, on the other hand, you have a maximum out of pocket. So the most you would pay in co-payments would be the $1,470. So you do have that catastrophic cap and protection under the Medicare Advantage Plus plan.
If I want to automatically join Medicare Advantage plan, do I have to call anybody or is it automatic, including prescription plan?
The Medicare Advantage Plus plan will be automatic. So if they want to be enrolled, they'll be automatically enrolled. They don't need to do anything. That will automatically happen. However, if they do not have the enhanced prescription drug plan today, they need to proactively enroll in that. They need to fill out a health benefits application with the Office of Labor Relations in order to enroll in the enhanced prescription drug coverage.
Under the MA plan, does the provider get paid 80% of allowable plan and 20% which are currently paid by senior care?
Under the Medicare Advantage Plus plan, the provider gets paid 100% of the Medicare allowable amount, less whatever member copayment there is. So we pay 100% of the Medicare allowable amount.
How do you receive reimbursement from New York City? Where do you send it to? What form is needed to obtain the $170 per month taken out of your Social Security?
You need to go onto the Office of Labor Relations website and look at the instructions for the Medicare Part B reimbursement paperwork. It's on the OLR website.
If we opt in, do we need Medigap coverage at all?
If you're enrolling in the Medicare Advantage Plus plan, you do not need Medigap coverage. Everything would be covered under the New York City Medicare Advantage Plus plan.
My spouse is not a city employee. In case I don't survive, how will my spouse be covered?
Well, surviving spouses will be able to continue under the plan and pay the COBRA premium for 36 months.
Okay. Can I enroll in the MA plan, not enroll in the enhanced prescription plan, but continue in the individual Part D plan?
Repeat that?
Can I enroll in the MA plan, not enroll in the enhanced prescription plan, but continue in the individual Part D plan?
No, the federal government will not allow you to be enrolled in both the group Medicare Advantage plan and an individual Part D plan at the same time. They'll cancel each other out. So you cannot be enrolled in both at the same time. If you want the Medicare Advantage Plus plan, you have to purchase the enhanced prescription drug rider if you want prescription drug coverage.
Is there any situation in which the out-of-pocket expenses could go above $7,500 per year?
Oh, you talking? That's the prescription.
Yeah.
That's the prescription drug program. So that's their true maximum out of pocket under the drug benefit. And then once they reach that true out of pocket, their member cost share drops down to the catastrophic phase, which are very low.
If I do nothing, will I automatically be enrolled in the Plus plan and the companion prescription plan?
Yes, well, no, they'll automatically be enrolled in the Medicare Advantage Plus plan. If they are not enrolled in the enhanced prescription drug rider today, they have to enroll and take action. If they are currently enrolled in that today, they don't have to do anything, they'll keep that.
Who are considered specialists? Everyone except the family physician?
Everyone except an internal medicine, family doctor, a family practitioner or general practitioner, and OBGYN. All others are considered specialists.
If dialysis is required, can the $500 home treatment be covered under MA?
The Medicare Advantage plan will cover dialysis in an outpatient setting or in an in-home setting.
If I pay out of pocket for prescription drugs, will I be reimbursed at the end of the year for money that I am paying for Part B?
I don't understand the question. I mean, the city reimburses the Medicare Part B as employee premium. But if they have prescription drug expenses, I don't know if those would be eligible for reimbursement from the Doctor's Council.
I'm being told it is eligible under the healthcare cost reimbursement for the welfare fund. Thank you. What psychological health services will not be covered by the MA plan?
The program covers all mental health and behavioral health benefits that are covered under traditional Medicare. So everything that's covered under traditional Medicare will be covered under the Medicare Advantage plan.
I'm also being told that we coordinate the psychiatric, we're secondary, and we coordinate for the psych benefits. Thank you for that. While Cornell does not accept Emblem Health for the 20%, or what can we do?
Well, Cornell is a in-network participating hospital. The providers affiliated with Well Cornell can bill the New York City Medicare Advantage Plus plan, and we will pay them directly. So we have those providers billing us directly for services. So that's how it would work. So they may not be in network with Emblem Health, but that doesn't mean that they can't bill us, and we can still pay them on the out-of-network basis.
How will the NYC MA Plus plan reimburse Part B as employee premium for Medicare eligible spouse?
The New York City Medicare Advantage Plus plan is not reimbursing the Medicare Part B premium. That is coming from the city of New York, and that is for both the retiree and the eligible spouse. They need to apply for that through the Office of Labor Relations.
I am not on any medications. Why would I have to pay $125 per month?
You have to be enrolled in a Medicare Part D plan, or you would be subject to a Part D penalty if you're not enrolled in a Part D plan. You would not be able to be enrolled in the Medicare Advantage Plus plan with an individual Part D plan. So that's why you would have to enroll in the enhanced prescription drug rider through Emblem Health.
My healthcare company is Advantage Care Physicians. I and my wife are covered by Medicare 80% and Emblem Health 20% of the senior care program so far. What happens now under the new program, New York Medicare Advantage Care Plus plan, ?
The Advantage Care Physicians are in-network contracted providers under the Medicare Advantage Plus plan. So you'll be able to continue to see those same providers, and you will pay a $0 copayment for your primary doctor visits and a $15 copayment for any specialists that you see within that group.
Does the Advantage plan cover dental?
The Advantage plan only covers Medicare covered dental, which is primarily extracts related to cancer treatments.
But you should know that dental is provided through the Doctors Council Welfare Fund. So dental is covered through the Doctors Council Welfare Fund. Do you have to sign up for the prescription program? Is it mandatory?
If you want to have prescription drug coverage, the only way you can get prescription drug coverage would be through the enhanced prescription drug rider that's offered through the city.
There's a suggestion that we should stop this now. It's gone on for too long. I appreciate the suggestion. I think we're coming to the end of the questions. We're appreciative of Kim and her team's time. And there's also similar programs later on. Kim, correct me if I'm wrong, but the MA, you and your team have ongoing online forums through the link that's been sent out. So this one is this one, but in February, ongoing, people can go into the ongoing webinars that you're doing. Is that correct?
Yes, we have, I think 14 additional meetings that are scheduled through February and March. And then there's also the pre-recorded presentation that you can access on the website and just click and listen to it. So it's a play on demand. So retirees will have the opportunity to hear my wonderful voice over and over again.
I would encourage folks that the emails that we sent out that has those links to the ongoing new and recorded webinars that Kim's referring to. Just hit the links that we've been sending out. If retired and not collecting Social Security yet, and will be 65 soon, how is Part B as in boy paid? If retired and not collecting Social Security yet, and I'll be turning 65 soon, how is Part B paid?
If you're not collecting Social Security, the federal government will bill you for your Medicare Part B premium, and they bill you quarterly, so you pay them directly.
Does the plan pay for EpiPens?
I don't know. I have to get back to you on that. I don't know if that falls under a pharmacy benefit. I don't think so. I have to get back to you on that. So Kevin, if you can send me that follow-up question, I will get that answer for you.
Sure.
Start with me.
I am retired above 65, still working, opted out of Medicare B. Will I be eligible in the Medicare Advantage B, Medicare Advantage plan without Medicare B? And if no, what are my choices?
You need to have Medicare Part A and Part B, so you need to apply for your Medicare Part B in order to be eligible for this plan.
Thank you for doing this very informative presentation and answering so many personal questions. I missed.
Kevin, if I could ask if it's possible to wrap this up. I think my fever's coming back. So.
Okay. Well, there's only 2 or 3 more questions. If that's okay with you,
Okay.
we'll stop it. I missed some of the explanation regarding the catastrophic cap with current Medicare versus the no catastrophic cap with Medicare Advantage plan.
So under the Medicare Advantage Plus plan, the catastrophic cap, which is the maximum out of pocket, is $1,470. So that's the most that a member is going to pay in out-of-pocket expenses, which includes your deductible, it includes your copayment. So that's what counts towards that cap. Under the senior care program, there is no maximum out of pocket, which means that all of your copayments will just continue to be paid. So let's say you exceed, if you spend over, $1,500 in copayments, it's going to just continue. It's not going to cap out. So you'll always be responsible for your copayments under the senior care plan.
Last 2 questions. Please clarify, if you do not want a prescription plan, do you have to sign up for it?
If you do not want the prescription drug plan, you have your 1 or 2 choices. If you do not want to enroll in the enhanced prescription drug plan through Emblem Health, you can opt out to stay on senior care and pay the buy-up premium, and then you can go out and get your own individual Part D plan if you want to. So that's where you need to weigh the costs of both plans.
Last question. Does the MA plan pay for the vaccine?
Shingrix is the shingles vaccine, and that's covered under the Medicare Part D plan. So that would be an Emblem Health benefit.
Not a question, but a comment. Thank you for organizing the meeting and answering our questions. Please feel better soon, Kim. I'll add to that. If you need a doctor, there's a whole bunch of doctors around here. We'll all go over to the house, and you'll have a whole phalanx of doctors.
It's the nasty thing of COVID come to visit the home. So I have not tested positive yet. My husband is, but I've had a fever all day, so I know it's inevitable.
So let us wrap this up. Kim and Marlon and your team want to say thank you for taking the time. Folks wanted to learn, ask questions. I think this has been an opportunity to impart information, answer questions that have been submitted in advance, to answer questions that were submitted on the Zoom chat. So thank you very much. Before I wrap it up, I'll just bounce it back quickly over to our president, Dr. Frank Proscia, if he wants to say a few parting comments.
Thank you both, Kim, Marlon, and the rest of the team. And thank you to doctors for attending this informational presentation. It was more than I expected. Thank you very much. I couldn't believe the amount of questions you did, and I really wish you well.
Thank you. I appreciate this opportunity. And if we need to do this again, Kevin, I'm offering it up to be able to do another session if you feel it will be worthwhile for your membership.
Kim, thank you very much for the offer. Thank you for tonight. Please feel better. And doctors and Kim's team, good seeing everybody until our paths cross again. To you and your families, please keep safe and keep well.
Thank you, everyone. I appreciate the opportunity.